The Department of Human Services was key in developing the Minnesota State Substance Abuse Strategy. We have Commissioner Lucinda Jesson here to talk a little bit more about this plan. Thanks for joining us, Commissioner.
Oh, I'm delighted.
Let's begin with the press release and even the subsequent press conference. It was talking about this plan, tackling substance abuse in Minnesota head-on. How so?
Well, we, of course, try to tackle substance abuse across our state, but we all do it in our own little silos. And we are the first state to come together as a state with a statewide plan. You know, a national study said recently that 15% of state government costs are due in one way or another to substance abuse, to addiction. Some of those costs are in corrections, some in human services, some in education, some in health. So we needed not just one department or one agency to take this on. We needed a plan that we could all get behind, and that's what we put forward.
How do you think this plan is going to impact Minnesotans?
Well, I want at the end of the next few years to see more early intervention, more prevention, where substance abuse is being, where there's illegal use of substance abuse, though, we have to tackle that head on. You know, which I think overall we're doing a good job of in our state. One of the immediate priorities we set forward was to immediately do something to tackle opiate abuse, including heroin. So I want to see those numbers where we see today they're going up, more and more people coming into hospitals because of overdoses of opiates, of illegal use of prescription drugs, heroin. I want to see those numbers coming down in a couple of years.
Dr. David Friends was at the news conference discussing this plan, and he stated that the results of one particular study showed that public education and tougher penalties rank last in prevention of substance abuse. So you talked a little bit about trying to hit early prevention here, but does this plan move away from those elements overall, or does it just try to strengthen them and perhaps move them up in the rankings?
Well, we want to do more of what the evidence tells us works, and spend our dollars less on things that don't work. What Dr. Friends was talking about were these very general, untargeted public education efforts, which aren't nearly as effective as some of our evidence-based early intervention efforts. So we certainly need to do more public education, but we needed to do it in a targeted way where the evidence tells us we can make a difference with the dollars we spend.
And let's talk a little bit more about the money. You have said it's not just about the money, it's about doing more with what we have. So have there been any areas specifically identified where you think you can do more with the funds that you currently have?
Absolutely. I mean, we, just at the Department of Human Services, we have a lot of block grants, money from the federal government, some state dollars as well, that we send out to local agencies across the state to help tackle substance abuse and prevent substance abuse, to support recovery efforts. But we need to look at all of those dollars and say, okay, let's not spend those dollars just the way we have in the past. Let's look at what are the best practices, as Dr. Friends said, and make sure we're targeting those dollars to interventions that work, to support recovery in ways we know work. So that's just one example in our department. I think there may be legislative components of this. For an example, one of the things we said is we need to look at our prescribing monitoring, the way we monitor prescribing. And now we have very voluntary prescription drugs, right? So that if I'm a physician and I'm prescribing these opiates, something like Vicodin to someone, you know, I'll be able to check and see, is that patient getting Vicodin from other doctors as well, and how much? You know, so we need to take a look at how we monitor that system going forward. So as I said, while there may be some legislative components, a lot of it is just doing a better job and a more coordinated job with the dollars we have.
The Center on Addiction and Substance Abuse at Columbia University estimates that state governments spend about 15% of their budgets on drug-related issues. That was a statistic in your press release that surprised myself, including several others. How can this plan reduce that amount?
Well, a number of ways. I talked some about doing more early interventions, screening. So when people come into an emergency room, that we're asking the questions. We're training physicians and others to ask the questions to see if that's someone we need to refer for treatment or for more evaluation. We need to integrate chemical dependency and addiction recovery efforts into our health reform discussion. So often, substance abuse is put in its own little corner, treated in its own way with its own special dollars. We need to bring it into our healthcare system. You know, where I see a lot of the dollar impacts of addiction It's not just in our substance abuse program. It's much more in our Medicaid program. Think about the healthcare dollars that we spend because of addiction. Think about, like, we have the child welfare responsibilities in the Department of Human Services. If you go into those court hearings to see when the courts are having to deal with taking kids out of their homes, putting them in foster care, so much of that is driven by parents' substance abuse problems. So if we can get our arms around those problems, we not only help those kids, we save our state dollars for having to take them out of the home in the first place.
And Commissioner, this is a multi-agency plan, and it involves so many different areas, from schools to you and your department. So do you think it can be effective, given that there are just so many players and so many cooks in the kitchen?
I think that's the only way we're going to have a big impact in Minnesota, but we have to be coordinated. So we need, for example, working with the Department of Corrections on their treatment in their facilities. Most of the people who end up in our correctional system, they have substance abuse problems. We need to make sure they get treatment early, so that, because most of those people are going to be released, and we want them to come out with a better chance of being in sustained recovery, not just cycling back to addiction and usually cycling back to our prisons. So that's why I was just so felt so good about the fact that there were so many state agencies that came together and said, yes, this is the right direction. Now we're going to be going out in other parts of the state and reaching out to local law enforcement, local public health officials, and local physicians and other healthcare providers, because this isn't just about state government, it's about our state as a whole. We need to have that commitment to make it work.
Okay, with those words, Commissioner Lucinda Jesson, thank you so much for joining us today.
Thank you.
We appreciate it.